Well, 10 years ago, I had diabetics. So since then, I'm taking a medication in 𝗕𝗟𝗢𝗥 because I went for gastrology problem. And since then I asked the doctor to do a blood test, complete blood test. And then he found my blood result was too high. So I follow with him. So I continue taking medication for a week. So for past 10 years, and then the sugar level is almost a balance, only 7, 8, 6, 7, almost around that. So I was taking medications nearly 10 years from there. And then before retired, so I went a normal government clinic to continue my medical checkup. So there I said, then they found for me there is a hypertension, but was increased. So they gave me also the hypertension medicine. Okay, one of the recommendations from my doctor. So we went for medical checkup at Sunway Clinic. So we took the full checkup, and then they said my heart level was not so good. So they asked me to follow up with the doctor in Sunway Clinic. So we went through, and then the doctor did some tests, and therefore there might be a block. It was unbalanced in the ECG result, which caused me, which makes him to go for angiogram. When he did an angiogram, he found there is 3 blocks. The right is 70, and then the other 2 is on our left-hand side. So is it around 70% only? So I didn't feel any pain at all. So when he did angiogram, so he was concerning on now whether you need to do the stent or not. Since already done angiogram, so I went out here. The doctor did a stent, and then we came back. It was normal, and there was a normal follow-up with the doctor of past 2 years. So then, since I left Sunway, so I went to normal clinic, my government clinic. So I was taking a normal medication until 2023. I was having a pain for urinary, so I went to GP clinic. So I told them to the doctor, I'm having a pain. He do some urine test, and he said there was a stone, and then he was giving some medication. But the pain never stopped. So what I did, so I went to pharmacy to take some medication. So I bought some medication from there, and then after taking some medicine there, so I was having a blood in urinate. The blood didn't stop. There was a blood coming and the urinate. So I went to pharmacy again and told her I was having a blood, and then this one. So I gave me another medicine, and then I took it. So the blood stopped, but the pain didn't stop. So I was having, and then past 2 weeks, I was continuing this medication. Suddenly, that Sunday morning, I can't urine at all. So I was having very pain. I informed my wife. I chilled her. So I went to GP clinic again. He told me straight away, go to the 𝗨𝗥𝗓𝗢 government clinic or any hospital to admit yourself to check on the fluid. So I went to KVJ, admit myself. And the doctor came in, and then he found, by doing some scan and result, and told me something is there. Some tumor may be growth, so they need to follow up, check. You need to do the scope, then only you can tell whether or exactly what is the cause of the urine problem, and as well as the pain issues. So after the 3rd day, on Wednesday, I was admitted and went for scope, and the result was, he was said there was a tumor brought in from kidney ureter to the bladder, and there was a growth in the bladder itself. So he said, and then after the result came, he gave me only 2 days to give the answer. I need to remove the bladder immediately, otherwise it will be danger affecting my life. So my option is, okay, if I want to live, I need to take it off. So I said, okay, no problem. But my family members, as well as my wife, my children, my son, elder son, second one, Logesh, second, and my daughter, as well as my daughter-in-law, told me not to in hurry, and they were looking for another option, where I no need to take my bladder, we'll go for some other medication. They searched the internet, and then we found few playlists. We went to Bangsa, something similar cancer clinic, and then Gomba, as well as treatment center. We went through, but we are not satisfied. And my sons, they are not happy with the treatment they are going to give. And my elder son found heal with it is another option. We came here, booked the date for the appointment, and then we came here.
This way, a lot of different treatment, not only end up in operations, right? So I have to thank them, So they really work hard. At last, they got it here. We came here for a consultant. So we explained to the doctor what the KPG doctor said. We show all the reports. So the next day, give us more confidence. Don't need to go through operation. Under treatment, even the treatment is really giving some suffering, the pain, the heat, but doesn't matter. He get tolerant with that. The rather end up with operation. Getting around. Also, that's the main thing the team here. We got 100% of pop. Yeah. Oh.
First of all, it's your immune system. You need to get it going. You need to boost up your immune system to get it better. So you don't have to take any medication. If your immune system is okay, everything will be okay. So the nutrition, you need to continue. And then followed by the treatment, you need to follow up. So when came out after the discussion with the doctor's place room, well, they were talking because the treatment, what gross telling is true compared to other doctors in other clinics. So they asked, my children told me, continue the treatment in here instead of going other places. So I went through hypothyroidism.
Okay.
And then detox.
Okay.
And then IV. IV, this is the thing you compulsory every week. So you need to say, doctor said you have to go or you have to get it IV upon the chemotherapy. So after the completion of chemotherapy, the next day I need to put IV. So I have to come immediately on the next day. So I won't miss up. So that is the important thing. And rectal therapy.
Okay, and then nutrition?
Nutrition is already given.
And then, of course, the food.
Yeah.
Food.
And then some injection-based injection.
You did that PEMF therapy?
Yeah. That was also because sometimes we are having a shoulder pain. So I just came and do the PEMF.
The FIR, sweat detox, you did?
Yeah, sweat detox even after completing what do they call? Hypotherapy.
Hypothermia.
And then the IV.
Yeah.
After the IV, then I go for detox, sweat detox.
Sweat detox, okay. And then during your chemo, any side effect you felt?
No. I feel very good because since I'm doing here, the hypothyroidism as well as IV and then sweat detox, after going to chemo and IRT, I didn't feel anything. And I feel like normal, like chemo, nothing. Nothing.
Before you started here, you were diagnosed urinary bladder cancer. So what is the condition now?
Condition now is nothing. Just
clear.
It's clear.
100% clear.
No growth at all. You only can see the scars.
Can see scars. Scars is normal.
Yeah.
And what about your, what is this? High blood sugar.
I was okay. Since June, when I came here, I'm not taking any medication on high blood pressure, diabetics, as well as the stillbirth.
That one also stopped?
Stop.
Okay.
Even though the doctor in Beacon asked me to take aspirin because you did angio, you need to continue with the aspirin. Dr. Lee said, no, you can stop. And because you are like cured and all, and then the immune system for you is working now. So keep it up, and then you feel better. And then you can do some exercise and then continue with food. What food you are taking to don't take outside food. That's it.
Pressure?
Pressure no more. 120, sometimes below that. One.
Cholesterol also you had, is it?
Additionally, yes. I didn't take any cholesterol medicine right now. God stop health since June.
Cholesterol also normal?
Yes. Since June, after doctor's advice, I'm not taking any medication at all. I stop everything. Even though even other doctors asked me to take, Dr. Lee told me not to take, so I won't take. Even I won't take Panadol. Even I won't take any painkiller. I am not taking any cough medicine or flu medicine at all. Even though if I got any flu or any headache, anything, no. So only thing I give a call to them. I'm having a pain. If I have a shoulder pain, I call the doctor. So he'll advise me to get a PEF therapy, then I'll be going off. So nothing more.
Okay. I see. Okay, so no medication at all now?
No medication complete at all. Even last statement in their website, I already told that I'm taking the treatment in healed with it. I'm not taking any medication for diabetics, none hypertension. So I'm medication free now.
How do you make you feel?
I feel better at all. 10 years ago, so the doctor asked in past 1 month, not 1 month, 1 year, they gave me the medication. I already started now covered. I want to give it away to somebody else.
Okay, and then your energy level before how was it? It was like very low, tired.
Yeah, nose raise, I'm very physical. So I'll go even sleep because I can't move with the stent. If I go bend down, I repain. That's all. It'll be really difficult for me. So what I feel after touching the stent, I can walk fast. I can go out staircase very fast. And no active, I will be doing more work.
You feel energetic?
Yes.
What about your movement? Are you restricted from any movement?
No. Now no movement. Stretch, can bend, can handstand. I can do any scratch, any exercise I can do. Currently, I'm doing some renovation. So I'll be a contractor to move off. So I'll be okay, move. More I do number of distance there. So I feel no tired at all. Only the muscle pain now. Now, just not walking complete because previous month I didn't walk too long. Now I'm walking too fast and then too long also. I didn't feel any tired. I keep on moving here and there, and then I instructing the contractor to do the job.
Yeah. Very innocent. Then what about your bowel motion?
Bowel motion? Cool, that is movement. Okay, no problem.
Okay, and then what about your sleep?
Oh, sleep is okay, no problem. Now, initially, I'll go for sleep. While doing the treatment, I'll go for 10 something. Now I stand back again 12.
Okay, you can sleep. So you get sleep, sure, but you can sleep quality.
Yeah. Before that, okay, in between also we went to Bicut because we told the doctor, so we to go to the Bicut. In additional, we do the RT as well as chemotherapy to make it a fast improvement. So we went through, we did that thing according to that doctor's requirement. We already complete. And final requirement is from the doctor urology to confirm to remove the stent. That was in a PG doctor, they put a stent on me. So to remove the stent, as well as to check the biopsy whether it is still there or not. And he confirmed, okay, or not December is it, or no, January, we did the scope on 28, and the result came on 11 January. The result was really fantastic, happy, we are all happy. So there was no growth at all. So it was very good. So we told immediately the doctor the result, so we are happy. It's really valuable for me. Initially, I disliked, but since my family support, so it's considered very valuable, even though the money spent is considerable. Now, I'm happier because there was nothing for me now. My sickness has been cured. Okay, cured means I don't give up. So I need to have a continued medication. The continuation is very important to follow up with our doctor's advice. The food also. Okay, that is important. So I feel really happy now to take the treatment here. Okay, my son told me initially that if you come here, the price will be 100K and above.
Yes.
You kept the money for that. Basically, you need to have that 100K. Initially, he told me 100K. And then as time goes on, I'm spending more. It doesn't matter as long as it cures. If he didn't give that advice, I don't think I'll be here. He forced me. Instead of spending money for this, why can you spend here for your health and then to get treatment? I keep on shouting at him. And then he said, it's for your health. So why can't you spend your money? Why you need to keep for what? So he questioned me. I said, okay. Well, one thing I am thinking every day, why I spending too much money here. So, but the result was very good. So I feel better. So there also, my family members, 5 children are there happy. And I saw, so even I can feel, I can look my grandchild on my peer. Self-discipline for himself is very good. Yeah. Without his self-discipline, that may could help you to improve your health.
This was the list. Do you use the number of money amount there? There's no discipline, no point.
No point. Not going to get the result.
Check in, mind fit. Even though beginning he might feel that in down, but then the family is there to stop him. So everything we think, do set up your mind. That is another thing. Yeah, that's the biggest role. If like
you said that you are very strong. You said, and I think that's what you did, right? You were telling me. You had set your mind. I don't want to stop this. Must prepare your mind, prepare the money. Yeah, complete it.
I don't want to be seeing fitness all the time, suffering. I don't want.
Correct. It's not good option.
Yeah.
Oh, very good. At that time, even though they are busy, there is just help you to prepare everything. And then my mother especially, I would really, there'll be only 1 EK so I'll need to wait for the patient to complete. Then I have to go for it. So after that, together with I will do the IV. After they are in, then they will tell me, okay, they'll be ready for the sweat detox. So they'll prepare the thing. Once coated, okay, then, and we are in a help of hurry.
Did their support help you to stay motivated and all that?
Yeah.
That's why the logic, when you say 1 hour, they say, no, you must do 2 hours to better.
I keep on asking 1 hour only. They force me to have 2 hours. So it is
in the modern part.
It is the best way for you to have good results, but you need to do 2 hours. Here the doctor and Miss Chung also advised me. Do it for 2 hours to get a better result.
So he preferred to do 1 hour, and the doctor personally comes book me. So he ran his chum also this thing.
Dr. Lee is also, how to say, he will also support you.
Fine.
The explain, been in the treatment. If any polite, make us like a friend. There's only no oil in our here. It's stimulating to see. I have a lot of breathing to answer. So it's really patient to answer on the questions. In that case, I really fake thanks to him. Then even myself, my son, all asked pretty much with that. This patient to explain something you draw for the. How is I don't know, is where you put.
If you have a tumor or blood cancer or anything, for myself or bladder cancer, whatever thing, okay, you need to consult with the right people. Okay, please do consult and check, okay, where is the right place. Don't take immediate step. Okay, previously I want to take immediate step. Just within 2 days, I'll be having a bladder outside. I mean, a urine bag will be outside. So now I'm really happy. I'm without that. So you guys, please take note on this. Get the advice from the doctor, especially just come and visit, share here and here with it. Take advice from the doctor. What will be the action or step you need to follow up. From there, you can learn how to improve your, treat your condition, okay, to cure your sick and then complete and back to normal healthier people.
Would you like to add something?
Yeah. Don't rush up. Take your time. Consult few numbers of doctors. Get a backup pictures and go on. So life is so you work. Miss TB and then 4 or 3 days. Self-discipline is important. Once you go back to doctors and doctor ini, go and meet the you can fix in your life.